Okay. Dementia. We wanted to mention this, and there's something that perhaps is something that's kind of growing as our community gets older. And dementia, in short, is a bit of a complex kind of explanation, but it's a progressive global deterioration. So what it means is that over time, this condition gets worse. There's a deterioration in your kind of intellectual function, brain function, personality and behavior. So the person who may develop dementia, is not the same person they were 10 years ago. And obviously for families, that's very upsetting because there's a complete change in personality. So with dementia, things come like a memory loss, difficulty performing their normal tasks. So people sometimes, when they're starting off with early dementia, they may forget the way to travel to a place they always used to go. But they forget how to do that. They forget their way back home, or forget their way to the relative's house. The behaviour, they can get some kind of unusual behaviour. So they may be disinhibited. So sometimes a person who never used to swear, for example, because of dementia, they will lose this ability and they will start swearing inappropriately, for example. They can often become quite down or depressed or have hallucinations, and they can become quite disorientated. So they can get confused with time and places, or if they come to a different environment, they get a little bit confused as to what's going on. It's a very difficult condition, both for the person that has it and for the carers. And
is it prevented? Can it be prevented?
Prevented?
What step I take for it?
Yeah. We'll come to that. I suppose there are two types of dementia. One is the Alzheimer's disease, which about 60% of cases, and the other one is what we call a vascular dementia, and there's another one called Lewy body dementia. The Alzheimer's disease, there are things they say that staying active, keeping the mind active, these things may help, but generally I'm not sure there's something you can do to really prevent it. The vascular type of dementia is related to kind of, just as the heart can have narrowing of the blood supply, the brain can also have that as well. So a vascular dementia is something that's more common in, say, smokers or those that have had have been overweight, too much cholesterol, high blood pressure, diabetes, those kind of things. So you can prevent things in that respect, but for many cases of dementia you can't really prevent. And they're saying in 2005, this is a few years ago, about 380,000 people have dementia. I don't know what the most up-to-date figures are. It's significantly rising as we're getting older. Just with regards to Alzheimer's disease, there are now a variety of medications that can reduce the progression of dementia. So there are some medicines that can reduce its deterioration. But unfortunately, over time, it still does deteriorate over time. But they mentioned things like...
Sorry, Uncle. Vascular dementia is linked to stroke. So the way you stop it is stop the stroke happening. So as Usman said about the smoking, lifestyle, cholesterol. So if you've had a stroke and you don't sort it out and you end up with another stroke, that's what causes the decline, in the memory and things. So it's linked to strokes, basically. Yeah.
And the key thing, though, on this point, and which is something perhaps we need to think about as a community and wider, is support for carers, actually. Because unfortunately, when we see patients in the surgery and they're often looking after their relative, it's a very hard job, because when someone has quite serious dementia, they require quite frequent attention, very frequent attention really, and carers themselves need a break. They need some time where people can go to a daycare centre or have some respite care where someone else can look after their relative. So these are the kind of challenges I think we are going to face more and more, as our population gets older, and it's a huge, huge issue.